傳媒朋友、各位香港市民，衛生署衛生防護中心因應昨日即係2月10日公佈第42宗個案，一位62歲嘅女病人，同喺1月30日確診嘅第12宗嘅個案，一位75歲嘅男病人，分別兩位都係住喺長康村康美樓唔同嘅樓層，但係同一個單位，即係07嘅單位。因此呢，衛生防護中心就主動同埋積極跟進調查呢兩宗個案，睇下呢兩宗個案嘅感染呢係是否有關聯嘅。呢個亦都係喺我哋往時喺抗疫工作裏邊建立咗個機制，就係話當似乎睇到係有啲環境嘅跡象，或者一啲屋宇嘅跡象會引發有一啲傳染嘅風險呢，呢個工作係需要馬上嚟到啟動。我哋必須要係主動咁去揾出呢啲情況，然後阻截病毒咧進一步係擴散嘅存在嘅風險。大家留意到咧，昨天我哋亦都係第一時間咧就係安排咗。
Yesterday, at the first instance, Dr. Wong Kar-heng of the Center for Health Protection and Professor Che Chi-man and Professor Yun Kok-yong met with the press late last night. Actually, it was midnight. They reported on the case in relation to the two confirmed cases at the Hong Mei House, Cheung Hong Estate. In a moment, my colleague will explain to you the arrangement for residents in the same unit in the block. Now, we attach great importance to the case. That's why, together with the relevant experts, we've been carrying out an investigation, and the investigations continue today. But as Professor Yun pointed out last night, this case is not the same as the case of the spread of SARS in Amoy Gardens. But we will not be vigilant. We will carry out a full-scale investigation. Now, this is a public rental housing estate. That means the housing authority is the landlord. Now, since we are seeing such cases in the properties of the housing authority, we, of course, are even more concerned. So we will take steps to reassure residents and the public. In a moment, the Secretary for Transport and Housing will give you some information. Now, later on today, we're going to send experts and engineering teams to the block. They will carry out a preliminary investigation and studies. And I hope they could meet with me today later on, and we'll listen to their report, and then we ask these teams to explain the situation to the public as soon as possible. In fact, yesterday, Professor Chen gave me a report at the first instance, so I was well aware of the operation last night. And I think this vigilant approach is entirely appropriate. After Professor Chen and Mr. Chen has spoken, I will tell you the overall situation after the implementation of the mandatory quarantine in the past 3 days. First, Professor Chen. Yes, let me report to you the latest situation. Last night, at Hong Mei House, Cheung Hong Estate in Chengyi, that's Unit 07. There are altogether 34 floors with the Unit 07. And on 2 floors of the 34 floors, that's the confirmed case number 12 and 42. So for these 2 patients, they're already in the hospital. The close contacts are also in the quarantine camps. And then for 23 residents in 23 units, they're also in the quarantine centers now. And in these 23 units, there are 3 households. And 4 residents have been put under medical surveillance by the CHP, and 4 are showing symptoms. So therefore, they are now in hospital. They are in 3 different hospitals: Prince Mrs. Margaret Hospital, Tuen Mun Hospital, and Prince of Wales Hospital. So they are taking tests there, they are under isolation, and they're getting treatment. For the other residents, as at 7 a.m. this morning, 20 residents have been sent to quarantine centers. Arrangement is being made for 3 other households. Now, for 20 households, they have been sent to 4 quarantine centers: Lady Mackley Ho's Holiday Camp, Lei Yuen Mun Park and Holiday Camp, Po Leung Kok Jockey Club, Park Sam Chung Holiday Camp, and Chao Chun Yi Academy, that is the Heritage Lodge. The CHP will continue with this work. As I mentioned, there are 9 units. Now, for 23 units, the households there went to quarantine centers. For 9 units, we are still carrying out the necessary work. For these 9 units, we will continue with the work today. The CHP has set up a hotline. So for residents, if they have any questions, they could get information from the hotline. The Food and Environmental Hygiene Department and Housing Department will carry out thorough sanitization at the building.
Dear friends of the media, so after the outbreak, all the public housing estate has stepped up their cleansing. And for the condition in certain housing estates, the escalators and the services in the common area and the hygiene work has also been stepped up. As for Cheung Hong Estate, our housing department and the FEHD colleagues have stepped up the disinfecting and cleansing to ensure the public health and safety. For Hong Mei House at Cheung Hong Estate, our colleagues and the estate management team and also visited the site and also to provide assistance to the investigation. Well, at this stage, at Unit 307, from our preliminary investigation, the relevant residents may have done their own renovation and modifications, and they have modified the vent pipes. Thus, our colleague will return to the site for more detailed investigation. I hope that you will not do some unwarranted speculation. And last night, Professor Yuen Kwok Yung and the Center for Health Prevention Projects, and out of safety concerns and out of prudence, and relocated the residents to ensure the hygiene and the safety. And when they left their home, they also allowed us to conduct a more thorough cleansing investigation. And as soon as we have the next stage of results, we will disclose to the public as soon as possible. And also appeal for the public health. What happened in Cheung Hong Estate is different from the Amoy Garden situation. At Cheung Hong Estate, the discharge pipes design is indoors, which is in the bathroom. For Amoy Gardens, the discharge pipe is outside the walls. So when there's a change in wind direction, and also with discharge and feces, or any rupture in the pipes, which is different from this time. And our colleagues has also stepped up the cleansing in our housing estates. And for the Cheung Hong Estate residents, if they have any concern or worry, we'll try to provide assistance. And I'll welcome any questions later on. Like Mr. Frank Chan said, let me reiterate that for the measures we took last night and will carry out this today, will act out of prudence. As you may recall, in this contagion containment, we have to get full on board. Even before the risk cases, we need to take a more cautious approach. And now that since the 8th of February, we've implemented the mandatory quarantine for the other arrivals from China. And for the 8th of 9th, 10th of February, that we have learned from 3 days of experience. So for the compulsory quarantine, operation have been largely smooth. And I have visited these 3 border crossings myself, and the cross-boundary visitors flow have gradually reduced, and the mandatory quarantine order required them to stay home to stop the risk of community transmission, as these persons cannot leave their designated home or accommodation. In other words, they were not able to leave Hong Kong as well. 3 days into their implementation, as of yesterday midnight, there are a total of 2,196 persons who are subject to compulsory quarantine. About 91%, which is 1,997 are Hong Kong residents. And out of these 2,126 quarantined persons, most of them have to quarantine at home, which is 2,080 persons. I must stress 2 points here. First, that those subject to compulsory quarantine, since they've entered Hong Kong through the mainland, and Hong Kong mainland is a vast territory. If they enter through any part of the mainland, or before their arrival to Hong Kong, they've been to mainland, anywhere in mainland in the past 14 days. Thus, they were not from Hubei province, nor the close contact of confirmed cases. When they arrived in Hong Kong, they did not show any symptoms. Thus, according to the professional assessment of the CHP, the risk of these persons is rather low. Thus, they can have this compulsory quarantine at home or designated premises to achieve the purpose of them entering the community or prevent them from leaving Hong Kong. Some accusations claim that these quarantined persons, well, for the figures I've provided, over 90% of them are Hong Kong residents, and some see that these quarantined persons are spreading the disease at the community. I see this accusation as untrue. And second, as for the implementation of this compulsory quarantine, and Professor Sophia Chen on yesterday's press conference had explained. I must stress that, well, that we hope for this. Those under quarantine will exercise self-discipline. Otherwise, they will need to suffer criminal consequences with a 6 months imprisonment and a $25,000 fine. On the same time, we also attach great importance to enforcement. We ask them to exercise self-discipline, then we just leave them to it. This is not true. To enforce this quarantine, we have devoted a lot of manpower and resources, and also prepared more manpower and resources to carry this work. So to implement this compulsory quarantine surveillance, which includes, well, in a contact center, there will be a communication software and smartphones. I must state that with the cooperation with the quarantined persons to share their real-time location to ensure they stay at their accommodation. I would like to thank most of the quarantined persons for willing to give the consent on this. We have also arranged some staff, which include police officers, to conduct spot checks. And also, CHP also has set up a contact center to maintain communication through telephone to confirm that they indeed stay at home or their premises. And Professor Chen already gave the arrangements as of yesterday afternoon that those who are in contact, including to a smartphone and communication software, real-time location sharing. We have contact over 500 of those. And through telephone calls, we have contact over 600. And through FaceTime, we also get in touch with 400. So that's the figures from yesterday afternoon. As of this moment, those who have been contact is still rising. And for those who are under compulsory quarantine at home, we need to provide the necessary assistance. We noticed that the family members or the relatives can provide this sort of assistance. The Home Affairs Department had also received 400 inquiries or call for assistance. And the relevant call for assistance will be referred to the Social Welfare Department. And over 50 households have been assisted involving 80 persons. As for the spot checks, the police in the past 3 days have conducted over 220 spot checks involving 350 quarantined persons, which were called upon. Well, the just mentioned work, we confirmed a huge majority of those under compulsory quarantine were at their accommodation and being very cooperative. And on 9th of February, 2 days before, we know there are 9 Hong Kong residents that have not stayed at their designated location at the time. From the enforcement perspective, we're very concerned. We immediately managed to locate 7 of these persons and also issue them a warning. The remaining 2 persons, the police have issued a arrest warrant. And for those who are not deliberately in breach of this quarantine order, we will consider prosecution. Like I said, those in breach of the quarantine order is a criminal offense. Upon conviction, the maximum imprisonment is 5 months with a fine of $25,000. Besides prosecution, at the same time, we'll make further arrangements with those who we've lost contact. For example, we're considering requiring them to wear wristband to step up surveillance. Or for second offense, we'll arrange them to move into the government quarantine centers. And now that we have a shortage of quarantine facilities, I appeal to all sectors of the community must work together and support of setting up quarantine centers in different districts, including quarantine centers and some designated clinics. Well, with the rise of quarantined persons, the amount of surveillance will increase. We'll also set aside more manpower, including our civil servants and also retired civil servants and volunteers, to join our contact center in order to reach out to the quarantined persons to ensure that this measure can be effective. On the other hand, you may also pay attention that the compulsory quarantine, after they have been enforced, that also drastically reduce the cross-boundary flow of people. So we're not going to lengths on giving the figures. If you're interested, we can provide them later. And recently, there's a confirmed case involving a family gathering, well, hot pot meal, which highlighted of the need of everyone to reduce social contact. That's why I said we have implemented some measures. For example, class suspension and work from home for civil service, and cancel most of the meetings and the public events. I hope that everyone could work together and be patient for some time in reducing social contact in order to achieve or fighting the disease together. May I appeal to the public once again that we must do our part to let Hong Kong win this contagion battle. Any questions?